particularly in the cases of fetus anomaly.
Huge mic.
Right. So myself, Muralidhar, I work at LV Prasada Institute and the financial disclosure pertinent to this particular talk. Excuse, cursor is not working. One of the most common developmental abnormality of cornea, wherein you have a centralized defect in the Descemet's endothelial complex. Generally, these are bilateral. You tend to have an iris strands which arises from the iris colorate to the edge of the defect. So which has an heterogeneous in origin, can have a variety of ophthalmic as well as a systemic syndrome. They can directly influence the final functional outcome. As I said, among all corneal abnormality, this accounts for nearly 40% of developmental abnormality. That's worldwide, where one of the common indications for a keratoplasty. As I said, it has a varying ophthalmic as well as a systemic associations. They directly influence the functional outcome in a long run. And you have a three distinct variant. Type 1, it is predominantly confined to the cornea. Type 2, wherein you have a failure of a lens to separate from the cornea. So these tend to have an extremely poor outcome following a keratoplasty. And the third variant, wherein you have a bilateral, in addition to the various systemic components, that we term it as a Peter plus syndrome. These are the certain examples. So if you carefully actually look at the slit wave, you have a focal absence of Descemet's endothelial complex in addition to the posterior stroma. It always used to intrigue me, when you have a central defect, something like that, you have a healthy surrounding endothelium, why doesn't it naturally heals? It appears that there is an anomalous abnormal endothelium within this primitive mesoderm. It is basically a neurocrystopathy. You can actually see an additional layer which is reduplicated. Perhaps this is actually inhibiting normal migration of the peripheral endothelium. That explains why Peters actually persist in the central part. Again, it's under eye magnification. If you carefully actually look at the entire anterior 2/3 of the stroma, including the epithelium and Bowman's, it is functionally, otherwise optically intact. The epicenter of the problem is in the posterior stroma that directly preclude the visual axis. Also, histopath actually shows, so again you have an anomalous layer which is mix up iris as well as an anomalous endothelium, which perhaps, as I said, inhibits the normal endothelial migration. That's a simple logic, is that something actually inhibiting with this actually led to this particular intervention. So although keratoplasty is a current gold standard for a Peters anomaly, but if you look in a long term, both functional as a survival, considering the longevity of these children, nearly less than 40% of them have an ambulatory vision beyond 10 years. So therefore, we were always in a quest to have some alternative approach, and this was a prospective study undertook at LV Prasada Institute the last 9 years. And we included particularly type 1 and type 2. Type 2, we limited. The reason behind, they tend to have a various systemic abnormalities which can come in the way. In the interest of the time, I'll directly go to the surgical video. It's a very simple technical. It's a central 4 millimeter corneal defect occupying bang on the pupillary area. I'm just severing the delicate iris strands from the colorate, staining to see the actual defect. And the way we actually polish the undersurface of the anterior capsule, in a similar technique, you can actually polish that anomalous endothelium which is occupying in the center of the defect. We can actually see the debris. Although I could not actually successful in aspirating these cells and subject it to the electron microscopy, because the inoculum is so low, and just confirming I have not induced any Descemet detachment. So I need to keep a Descemet here, thereby recovery would be much faster. As again, I guess if we end up doing a Descemet or excess, there may be a risk of having a complete DM detachment, and the recovery may be further delayed. So we had totally 34 eyes of 28 children, and I took deliberately unilateral cases because these are isolated cases, tend to have a much better outcome. At the end of our study, nearly 86% of them had a discernible central clearing. These are the additional surgeries were performed in addition to simple endothelial removal, and nearly 44% of them had ambulatory vision. Considering nearly 50% of children under 1 year, because the visual assessment may not be very accurate in these children, at least their acceptance to the patching and compliance to the glasses actually one of the indirect evidence these children are doing well. To show you some of the best case scenario, if you look at in a 12 months time, the opacity is hardly visible in this particular slide, where even you can actually do a good refraction. And the sequential OCT of the same patient again actually shows the endothelium is relaid down by the new cells. These are some cases which had a moderate outcome. Again, this has a moderate outcome. This one particular case had again a poor outcome. It necessitated a subsequent keratoplasty in this case. Again, a moderate outcome. And this is one of the keratoiridolenticular dysgenesis. You could actually see a rudimentary lens and converted into FAK, had a extremely good vision with a contact lens. And this stroma tend to remodel over a period of time, and your opacity tend to get fainter as the time progresses. This child had a bilateral abnormality. If you can look at the last picture, there is a discernible change in the corneal opacification. To conclude, so our new innovative technique, in fact, it is a superior alternative to the penetrating keratoplasty, considering the longevity of these children. And we need to carefully select these cases. And visual acuity could be significantly improved, but typically limited due to underlying refractive error, residual corneal opacity, and amblyopia due to late presentation. And further studies needed to define the case selection, long-term outcome, and complications if there are any. In our series, we didn't have any complications. Thank you for your kind attention.
Very interesting and a novel